Good morning and welcome to the 19th Annual Nurse Tech Symposium. On behalf of Mount Sinai Heart, my name is Beth Oliver. I'm the Senior VP for Cardiac Services in the Mount Sinai Health System, and it's my pleasure to be your hostess today. I will be your MC. Before we begin, I would really like to thank our system hospitals, Mount Sinai BI, Mount Sinai Brooklyn, and Mount Sinai St. Luke's for joining us. Also our affiliates, Richmond University Medical Center, as well as Jupiter Health, Jupiter Medical Center in Jupiter, Florida. I am going to be speaking today about Carpe Diem, how cardiac catheterization lab nurses and techs can improve global health and seize the day to make a difference. Cardiovascular disease, the reason why the song is because it affects everyone. Cardiovascular disease is the leading cause of death in the world and in the United States. Heart disease and stroke killed 17.3 million people worldwide in 2012. 3 of every 10 deaths worldwide were caused by cardiovascular disease. Okay, let's see. Having a little technical difficulty, I'm sorry. So everybody did receive a clicker, and this is where it's a little interactive part, and we want to check your knowledge. And so if everybody can put it on, we'd like you to answer the question. We're going to give you 10 seconds. Which country has the highest rate of death from cardiovascular disease? 1, India, 2, the United States, 3, Philippines, 4, Turkmenistan, 5, Sierra Leone, or 6, France. Okay, and let's see. A lot of you picked the Philippines. Okay, all right. Well, you will see that, oops, I'm really messing up here. The real answer, let me just see if I can go back, is Turkmenistan. Believe it or not, and that's probably because most of them smoke. There's alcohol, high alcohol consumption, their diets rich in meat, saturated fat, and lack of exercise. France is 86 because, of course, it's the red wine and they do everything in moderation. Cardiovascular disease, unfortunately, knows no boundaries and is a killer worldwide. So just looking at this, cardiovascular disease affects both rich and poor countries. In 2008, cardiovascular deaths represented 30% of all global deaths, with 80% of those deaths taking place in low and middle income. And you can see with the purple bar. So the World Health Association, WHO, came up in 2000 with the Millennium Development Goals. Those were 8 goals for people as 191 countries got together to really improve a host of things. Unfortunately, their end was 2015 and they didn't achieve the goals, so during their summit in 2015, they came up with 17 sustainable goals, otherwise known as global goals. Overall, overarching theme is to end poverty, fight inequality and injustice, and tackle climate change by 2030. But the one that I'm going to focus on with you today is good health and well-being, because that's the one that we can make the most impact. So how do we do on that, on good health and well-being? Well, according to the Commonwealth Fund report in 2013, as you can see out of the 11 countries, and on the far right, the US is number 11. We're the worst in our overall ranking, in our quality care, and our access to care, and we spend the most. And England, right next door, spends the least and has the best outcomes. They're number 1. So I think that the overall is that they have more access to care. Again, cardiovascular disease still kills more people in the US than all forms of cancer combined. There's still the myth that cancer, but you can see that heart disease overwhelmingly is still the number 1 cause. So what are the real causes of death? Well, the real causes of death, the top, are heart disease, cancer, and stroke. But when we sign a death certificate, that's what we put. But really, the actual causes of death are our risk factors. It's tobacco, smoking, poor diet, physical inactivity, and alcohol consumption. So really, what's going on, just to re-review, we do all know what the risk factors are, but for example, male gender, sorry, guys, age, men greater than 45 and women 55, a family history of premature CAD, CV events in a male relative less than 55 or a female less than 65 in a first-degree relative, and the modifiable risk factors, which we all need to work on together: smoking, high blood pressure, dyslipidemia, high LDL, low HDL, diabetes, physical inactivity, overweight and obesity, a diet low in fruits and vegetables, and stress. So how are we doing as a nation? Well, for smoking, 20% of adult men and 16% of women are still smokers. 16% of students in grades 9 through 12 are smokers. And we haven't even gotten to see the effects of e-cigarettes and vaping. Physical inactivity, 31% of adults report no leisure time physical activity. Only 27% of adolescents meet the AHA recommendation of 60 minutes per day. And one of our big focuses at the American Heart Association is to bring back physical education into the core curriculum in schools, particularly for the younger children. Healthy diet, less than 1% of adults meet the AHA definition for an ideal healthy diet. That's fish twice a week, 4 to 5 servings a day of fruits and vegetables, 3 servings of grains or fiber, less than 1,500 milligrams of sodium, and less than 3,600 of a sugary beverage, cutting down. And this is really staggering that no children meet that definition for a healthy diet. For overweight, 159 million US adults, 69% are overweight or obese, 32% are overweight or obese, and out of that 32%, 17% are actually obese. Approximately 43% of Americans have a total cholesterol greater than 200, and about 20% of Americans have a low HDL. For high blood pressure, 80 million Americans, 33% have high blood pressure, and only 46% with hypertension don't have their blood pressure under control. Rates of high blood pressure among African Americans is among the highest of any population in the world. For diabetes, which you'll be hearing later, about 21 million adults, 9%, have diagnosed diabetes. Many others are undiagnosed, and the incidence is rising. Approximately 35% of Americans are pre-diabetic. African Americans, Hispanics, Latinos, and other ethnic minorities bear a disproportionate burden of disease. So AHA came up in 2010 with an ideal concept to go, instead of treating disease, let's really focus on cardiovascular health. Reframe the idea of cardiovascular health as not just the absence of cardiovascular disease, but also the presence of positive factors that promote longevity, healthy longevity, and quality of life. Ideal cardiovascular health is defined by the absence of clinically manifest cardiovascular disease together with the presence of 7 health metrics. It's known as Life's Simple 7. I believe that you all have it in your packet, and some point today you should take it out and try and score yourself. It's 3 health factors and 4 health behaviors. The health factors are optimum total cholesterol, optimum blood pressure, optimum fasting blood sugar, and the healthy behaviors are not smoking, having sufficient physical activity, healthy eating diet, and maintaining normal weight. So this slide is just to give you an idea. It's on the back of your scorecard so that you can read it. It gives you the metric poor health, intermediate health, and ideal health. I'll just do one like smoking. If you're smoking, you're in poor health, you'd rate yourself. Intermediate is a former smoker who quit 12 months ago or less. And ideal health is that you've never smoked or you quit more than 12 months ago. And again, it also over here gives you the 5 components of a healthy diet that I had gone over. So how are we doing on each metric? Well, you can see that we're not doing well at all. Certainly red is not good, and we're not doing well in healthy diet, physical activity, or body mass index. And how many US adults have the ideal score on those 7 metrics? The good news is that only 1.8 of Americans have no ideal metrics. The bad news is that only 0.1% are ideal on all 7 activities. And everywhere else, everybody else is somewhere in between. About 24% is in the middle, so we've got plenty of room to improve. Oops. So where do you all fit in? Well, we want you to start in your own corner of the world. take care of your own cardiovascular health, achieve an ideal score on all 7 metrics, educate yourself on how to lower your risk factors and prevent cardiovascular disease, educate and support family members, friends, and patients to reduce their cardiovascular risk, reach out to your community to help lower the risk, be prepared to be a global leader in helping us promoting health, and the world needs you, and more importantly, we need you. So thank you, and I'm going to now introduce, it's my great pleasure and privilege to introduce to you Samin K. Sharma, who's the president of the Mount Sinai Health Network and the co-director of Mount Sinai Heart. And I would be remiss if I did not thank him and Dr. Kinney for their support for this symposium today that's been going on for 19 years. We couldn't do it without them, so thank them very, very much. Dr. Sharma is an interventional cardiology expert, as we know, and is well known for performing high complex coronary interventions with a very high success rate. The Mount Sinai Hospital Cardiac Cath Lab has become one of the safest and busiest cath labs in New York City and in the state, and really in the United States, for all types of simple and complex heart procedures. He has received several 2-star awards, which is a very prestigious award from the Department of Health, recognizing his safety as an operator. He also specializes in the non-surgical treatment of mitral and aortic valve disease, including the transcatheter aortic valve replacement, which you'll be hearing about later on today, and the mitral clip. He has been dubbed the master of the rotablator and is regularly featured on national TV. He has received numerous awards. There's a very prestigious award, the Jacobi Award, but the nurses in the audience know that the most important award is the Nurses Award that's given every year, and he did win that in 2006. He's authored many papers, many book chapters. He's a philanthropist, and the Mount Sinai Hospital Cardiac Cath Lab is now named after Dr. Samin K. Sharma Family Foundation Cardiac Cath Lab. Dr. Sharma has built a 250-bed hospital in his native Jaipur, India, to provide the best care to all patients, irrespective of their financial and social status. It is my great honor and privilege to introduce to you Dr. Samin K. Sharma.